Hi, my name is Phil Kyle, and I'm the CEO and co-founder of NuPhase Solutions, LLC, a brand new and exciting medical device company developing a treatment for neurological and psychiatric disorders. My background is in chemical engineering and biophysics, and I've always been interested in neuroscience. So when I was looking for a major problem and found out that there was research being conducted at the University of Arkansas in precisely this field, my team and I jumped at this opportunity. The research being conducted was on a new approach to transcranial magnetic stimulation, or TMS. This technology could be used for a host of neurological and psychiatric disorders, as well as a brain-computer interface. Therefore, our very first pivot came when we thought the best application of this technology was a disorder such as Alzheimer's, schizophrenia, or tinnitus, which currently has no real treatment option. After speaking with neuroscientists and psychologists, however, we switched our focus to depression. Not only was this a huge problem that affected some of our friends personally, there is also a clear regulatory pathway through the FDA 510(k) approval process as a Class 2 device. Depression is the leading cause of disability worldwide. I spent nearly 6 years in the military and personally know veterans that have battled this terrible disorder. Unfortunately, only drug therapy and counseling have traditionally been available to those suffering with depression, and those come with a long list of severe systemic side effects that ultimately fail to work for a large majority of sufferers. TMS stimulates the brain through strong but brief magnetic fields that manipulate states of neuroplasticity. This is the brain's ability to change itself in order to make new connections where there are currently broken pathways that are presenting as depression. I'm proud to introduce you to our proprietary NuSync solution, the safest, most targeted, cost-effective, and non-invasive solution to major depressive disorder that has zero systemic side effects as seen with traditional drug therapies. NuSync is a combination of two FDA-approved methods, EEG and TMS. We solved our competitors' problem of indiscriminately applying magnetic stimulation without regard to underlying brainwave activity by measuring and predicting brainwave activity down to milliseconds and applying stimulation to the optimal brain state for treatment. This brings us to one of our most recent pivots. We originally thought that we wanted a fully enclosed device that encompasses the EEG, TMS coil, and software because we were focused on the aesthetics, patient-physician user experience, and ease of use of our device. These are still important, but after further discussion with psychiatrists, we would like to develop a device that is a bit more modular and mobile in nature. We discovered that many clinics do not have a room to devote full time to this treatment, and allowing the device to be mobile would allow a physician to maximize the ability to treat patients per square foot of the clinic. It also has the additional benefit of allowing us to sell just the module that analyzes, predicts, and sends the output signal to the TMS coil to researchers or clinicians that currently have a coil and do not wish to purchase an entirely new device. After all, our secret sauce is not in the coil design. It's in the integration and synchronization of the stimulation to the ideal brain phase for treatment. Our approach results in a 2.8x increase in efficacy over the TMS treatments that are currently available. With current TMS treatments seeing a 62% reduction in depression symptoms and a 41% complete remission rate, this 2.8x increase provides the possibility for the NuSync solution to become a first line of treatment. Major depressive disorder, or MDD, currently affects 121 million people globally. Of those with MDD, up to 30% do not respond to antidepressant medication. This is an important group because TMS currently approved to treat MDD patients who have failed to respond to a previous treatment in the current episode. Globally, this represents a total addressable market of $364 billion. We are creating value most immediately and directly for the 95% of psychiatrists who haven't yet adopted this technology. As TMS treatment is approved for additional disorders, we will be primed to capitalize on the diversified market in healthcare specialists. The tertiary segment addressed in our value proposition is the end consumer, the patient. Currently, over 4 million people in the U.S. suffering from MDD qualify for this treatment, and over 230 million have insurance coverage for it. Greater penetration in the market of healthcare providers is needed to satisfy customer demand. When interviewing psychiatrists, physicians, and neuroscientists, they indicated several key areas that will be important to them while treating depression. What is most important to them is the quality of life for their patients. You can see that the NuPhase TMS system is the only option that addresses all of these concerns compared with the other TMS, electroconvulsive therapy, counseling, and pharmacological treatments. That is why our value proposition first includes performance. Using EEG allows for phase locking of brain stimulation with TMS, resulting in a more targeted and effective treatment of psychiatric and neurological disorders. Second is that our innovative pricing structure offers added flexibility, eliminates a per-treatment consumables charge, and decreases the risk and payback period for our customers. Through our market research, we found that physicians are data-driven shoppers, and their path to purchase relies on three main sources of credible information: search and web content, sales reps, and peers and key opinion leaders. NuPhase will employ an experienced and highly incentivized direct sales team as our front line of customer contact. We will expand our presence among the medical community through facilitating field studies, attending trade shows, and maintaining a close network with thought leaders. 63% of physicians contact a vendor after watching videos online. Therefore, our web and mobile platforms will be an engaging and streamlined first point of contact with our customers to reduce the cost of reaching clients. NuPhase Solutions will maintain a close relationship with the client post-purchase. The high degree of complexity associated with the device will require dedicated support from a team of on-call technicians and client support personnel. Support services will be rendered at little or no additional cost to the client. Additionally, through our website, we will provide patient education, blogs, and advocacy. Revenues will be generated from sales, leases, and grants. Our selling price is $100,000 per device, which is comparable to our competitors and eliminates the approximately $100 per treatment disposable cost that our customers have said they strongly dislike. The lease is structured as a 4-year lease with an option to purchase after expiry. The annual lease payment for the device is approximately $32,000. Under this lease structure, physicians will exceed the break-even point by treating only one patient per month. This will require a few key resources, the first being physical. NuPhase is currently undergoing negotiations to select an external partner skilled in the medical device industry to handle engineering, design, and prototype development. As we further customer development, the design of our device is continuing to evolve. On the intellectual front, we have an exclusive option on the patent of the phase locking software, but we'll need to acquire some IP surrounding the magnetic coil. A key to success will be identify and onboard a chief medical officer who can guide us through a successful clinical trial and increase the probability of obtaining grant funding. We will also be hiring a regulatory specialist and a VP of marketing and sales within the next 2 years. That brings us to the financial resources we'll need to complete trials, product development, and patent protection. A large portion of these financial resources will come from non-dilutive grant funding. In order to comply with FDA requirements for the manufacturing of medical devices, we will outsource the detailed design and manufacturing of NuSync to a third party. We will require a combination of R&D partnerships to enter the market and continually develop the technology. Expertise in clinical trials will be crucial to driving the acceptance of our devices, especially when expanding towards other disorders. NuPhase will offer training, support, and maintenance services. In order to be a viable treatment option for physicians and patients, we will have to ensure that insurance companies will consider our device a covered service. We also need to exhibit a proficiency for developing our marketing and sales tactics. Key partners include our external design and manufacturing partner, network of researchers and physicians, and third-party payers. They would work with us because we create significant incremental revenues for the manufacturers. The treatment itself is highly profitable, and most insurance companies offer some form of reimbursement for TMS therapy. Also, researchers are highly interested in the application of this technology in a variety of formats, and there is an opportunity to offer our devices to them at cost in exchange for conducting and publishing field studies. Finally, from our negotiations with our prospective manufacturing partners, we have estimated our cost of goods sold, including all relevant device taxes, to be approximately 40% of our selling device. The largest cost of reaching our customer is the 3% commission paid to our direct sales team. Total SG&A expenses are estimated to be about 35% of revenues, and this will decrease as we scale. We have allocated 7% of revenues for R&D and 5% for general marketing spend. Finally, we have a fantastic team that combines expertise in engineering, physics, neuroscience, clinical trials, regulation, and venture capital funding strategies that are dedicated to executing this strategy. Thank you, and please feel free to reach out and contact us. We will need your help in making this dream a reality and working with your brain, not against it.